Assalamu alaikum everyone. Today we're gonna talk about nervus trigeminus, that is the first cranial nerve. First of all, I'm going to provide some kind of necessary information that related to the anatomy of the trigeminal nerve. The trigeminal nerve exists from the pons and can produce some kind of ganglion there. This ganglion is caused by the pseudonuclear cells soma. Okay, the pseudonuclear cells located there, and their main function is receiving impulses from the face. And the last number of pseudonuclear cells can shape some kind of ganglion there. Okay, and the next structures are three branches. First branch is ophthalmicus branch, second one is maxillaris, third one is mandibularis. As the ophthalmicus branch exists from the skull via orbital fissure and can divide to two parts. First one is frontal, second one is nasociliary. Look at that. In the red shade parts of the head is innervated by the ophthalmicus branch of the nervus trigeminus. Second branch is that's name is maxillaris. Maxillaris exists from the skull via foramen rotundum. And look at that. And the blue shade of the face that I draw there is innervated by the mandibular branch of maxillary branch of the nervus trigeminus. Okay, the last branch is maxillaris branch. Maxillary branch exists from the skull via foramen ovale and innervate this dermatome. Okay, in the blue color, in the green color, sorry. And I should provide that the first one, second. That's ophthalmicus and maxillaris branches, sensory branches. They receive the impulses from this part of the head. Okay, and the mandibular nerve have further function. It contains some kind of motor fibers, and they innervate the muscles that's responsible for the chafing action. Okay, their name is pterygoid muscle, temporal muscle, masseter muscle, and mylohyoid muscle. And in the green color, I draw these fibers that's responsible for motor activity. They are this fiber, and this fiber, and this fiber. Okay, and I should note that there is two main fibers. They are inferior alveolar and lingual. Lingual is responsible for receiving the impulses from the anterior two-thirds of the tongue, and the inferior alveolar fiber is responsible for innervating the lower thesis. Okay, that's located in the mandibular lower jaw. And next information, further information that's related to clinical consideration is that's viral infection is herpes zoster. Herpes zoster is a viral infection and locate this ganglion. And when the immune system is depressed, this virus tries to show its negative effect by showing some kind of vesicles and some kind of painful condition in these dermatomes. Okay, in the red and in the blue color. And the next information is some kind of nucleuses and sensory fibers and motor fibers of the nervus trigeminus. And I prefer to initiate with motor nucleus. Motor nucleus receives the impulses bilaterally from the motor homunculus, and it can direct the impulses to the muscles that's responsible for the chafing action. Okay, as it's responsible for the chafing action, the muscles are pterygoid muscle, masseter muscle, mylohyoid muscle, and temporalis muscle. And they exist from the trigeminal nerve via mandibular branch, not maxillary or ophthalmic branch. Don't forget that, that's the main point. And the next, that's clinical considerations there. And if the lesion located there, for example, maybe stroke or tumor and something like that, the innervation from the one side couldn't cause any clinical appearance in the patient. The patient couldn't have any difficulty in achieving the actions, okay? Because of another nerve innervation from the another hemisphere to the, that's intact, because it's intact and it can supply this neuron by enough information, okay? And next information about the sensory system. First of all, I'm going to initiate with principal sensory nucleus. One of the main functions of the principal sensory nucleus is receiving the temperature and pain impulses from the face, okay? And all of the three kind of dermatomes, they receive pain and temperature information, and the pseudonuclear cells direct the impulses to the principal sensory nucleus. Principal sensory nucleus, in the principal sensory nucleus, second neurons initiate and they direct to the contralateral part of the brainstem, okay? And they try to combine with the lateral spinothalamic tract. You know, the main function of the lateral spinothalamic tract is carrying the painful and temperature information from the lower limb, trunk, and the upper limbs, okay? And they direct to the thalamus together, and after the thalamus, the third neuron will initiate and it can reach to the postsentinel gyrus for analyzing the information about the temperature pain, okay? The next sensory system, sensory nucleus, is spinal nucleus. One of the main reasons for this name is it will continue to some kind of to the same level of the spinal cord, okay? And there is some kind of loci that's responsible for special parts of the nervous trigeminus. The spinal neuron receive some kind of touch sensation and proprioceptors that's responsible for the chafing action, okay? And all of the three dermatome generate some kind of touch information, and these impulses reach there to the pseudonuclear cells in the black color, in the black color, and they direct the impulses to the spinal neurons. At the spinal neurons, second neurons generate, and second neurons generate action potential, and they direct to the contralateral from left to the right side, okay? And please look at that. They try to combine with the medial, combined with some kind of fibers that's responsible for carrying the proprioceptive impulses to the hemispheres, okay? You know, the dorsal column carries information that relates to proprioception, and after getting the nucleus cuneatus and gracilis, they start as a second neuron contralaterally, and as a proprioceptive receptive impulses available in the spinal neurons, they try to combine with these fibers that originated from the dorsal column and directs to the thalamus. As the thalamus, the third neuron initiate and it reach to the postsentinel gyrus, and at this part of the hemispheres, sensory information will be analyzed, okay? And our last neuron is mesencephalic neuron. Although there is a lack of information about the mesencephalic nucleus, some kind of resource provide information that this nucleus is responsible for proprioceptive impulses, analyzing the proprioceptive impulses that come from the teeth, okay? That's further information for you. And one of the clinical consideration is that related to the nervous trigeminus is trigeminal neuralgia. Trigeminal neuralgia is very intense pain. We can describe it as shooting pain, and According to its level of pain, patients may have suffered from some kind of disturbance that can disturb them to conduct their lifestyle normally. Okay, one of the main reasons for this neuralgia is superior cerebral artery. Superior cerebral artery is located the upper part of the trigeminal nerve. Okay, it's located the upper part of the trigeminal nerve, and according to some kind of structure of this blood vessel, it can compress the nerve trigeminus. As a result, the shooting pain can generate. Most specifically, the pain can radiate to this part, most specifically. Okay, and one of the main treatment for the neuralgia is by using some kind of drugs to relieve this pain. But as a neuropathology, we couldn't relieve the pain. We should consult the patient to go to the neurosurgeon. There is some kind of special tool is inserted between the superior cerebral artery and the nervus trigeminus by neurosurgeons, and the relief may be relieved approximately 100%. All of the necessary and beneficial information for you all today. Thanks for listening and watching. And if you have any suggestions, offers, or disagreements with our video lessons, we are always ready to accept from you in the comment part of our YouTube channel. Check it yourself. Thanks for listening and watching one more time.